So what is life expectancy? Life expectancy is the number of years of life that the individual is expected to live. For example, in Canada, the average life expectancy is 81 years old. Life expectancy is an average, therefore is most often used in the context of human population. It can vary from country to country, and it can change over time. Regional variation. There is a great variation in life expectancy between different parts of the world. For example, the life expectancy in Zambia is 39 years old, compared to Ireland, where the life expectancy is 79 years old.
For example, the life expectancy in Zambia is 39 years old, compared to Ireland, where the life expectancy is 79 years old.
Factors affecting variation from country to country. This is mostly caused by differences in diet, public health, which is preventing disease and promoting health, and medical care. We cannot change our genes, so finding factors that affect our life expectancy is important.
We cannot change our genes, so finding factors that affect our life expectancy is important.
Moreover, other factors that affect life expectancy are climate, diet, access to medical care, disease, population, sanitation, public health, obesity, smoking, and drug use. These factors have connections and affect each other. Money. Much of these factors are affected by economic resources. Studies show that the life expectancy of poor individuals is much lower because, for example, they cannot purchase healthy food. Diet. Diet plays an important role in the overall health, for example, disease prevention. Food availability is a huge factor affecting life expectancy. It can vary from region to region. Some countries may have limited access to a certain type of food, leading to vitamin and mineral deficiencies. In addition, food availability may be scarce in some regions, for example, Africa. As a result, the life expectancy may be a lot lower because people are dying from starvation. On the other hand, there is an increasing rate of obesity in North America because of overconsumption. Climate. Climate includes temperature, humidity, wind, and precipitation. It has a strong impact on a variety of environmental factors which in turn affect people. Climate affects agriculture by providing specific conditions to grow, which is important for food availability. Climate includes temperature, humidity, wind, and precipitation. It has a strong impact on a variety of environmental factors which in turn affect people. It affects agriculture by providing specific conditions to grow, which is important for food availability. Climate plays a role in which foods can grow in which region. Climate affects where, when, and how much water is available for people to use. Moreover, climate affects the health of people. For example, vitamin D provided by the sun and is typically deficient during the winter months. Heat waves, severe storms, air pollution, and diseases linked to climate already threaten people's health in many areas of the world. For example, vitamin D is provided. Public health is important to prevent disease and promote health. Public health in many parts of the world has reached crisis level. Over 40 million people globally are infected with HIV/AIDS. The disease kills over 3 million people annually. One of the roles of public health is to provide education on sexual health. In addition, the number one cause of death in the world is cardiovascular disease. This disease can be prevented through education, for example, diet and exercise. Moreover, the importance of public health is increasing. Obesity is becoming a cultural epidemic in North America. Research has found that obesity can shorten a person's life by up to 10 years. Medical care. Gains in life expectancy worldwide have been greater during the last century due to medical care. It has several important functions other than restoring or maintaining health. In Canada, we have universal health care, which means everyone has access. On the other hand, in developing countries, medical care is more challenging to achieve. This has negative side effects on the life expectancy in developing countries because people may die from something that could have been treated if they had access to medical care. Sanitization is something we take for granted. A lot of developing countries do not have the same sanitization practices available. This can lead to the development of unwanted disease. Yeah,
For example, in many less developed countries,
don't know how to
burial
do do it at the
The
same
leading
time
cause
as
of
my
death is
PowerPoint.
typically spread by person-to-person contact or fecal-oral routes. Many times,
For
by using
example, in
cotton
many
syrup
less
and
developed
colorway.
countries,
This
diarrheal disease is
demonstrates
the
the
leading
importance
cause
of
of
hand
death. It is
washing to
typically
prevent
spread by Technology is constantly improving and is likely to provide help in
Technology is
advanced
constantly
countries.
improving and is
As a
likely to
result,
provide
most
help in
people will be
advanced
able to
countries.
survive
As
chronic
a result,
illnesses
most
because they
people
will
will
be
be able to
diagnosed
survive
earlier and
chronic
get better
illnesses
treatment.
because they will be
In
diagnosed
developed
earlier
countries,
and get better
doctors
treatment.
predict that today's
In developed
babies
countries,
are likely to
doctors
live to
predict that
age
today's
100.
babies are likely to live to age 100.
In summary, many interrelated factors affect life expectancy, much of which are related to economic resources and availability of medical help. As a result, life expectancy is much higher in more developed countries. Thank you for your time.
In summary, many interrelated factors affect life expectancy, much of which are related to economic resources and availability of medical help. As a result, life expectancy is much higher in more developed countries.